Welcome back to Understanding Depression, where we talk about mental health with honesty, clarity, and compassion. Today's episode is one that many people have been waiting for. We're diving deep into the world of antidepressant drugs. How do they work? Are they really effective? And what about side effects? Whether you're someone considering medication, supporting a loved one, or just curious, this episode is for you. In this episode of Understanding Depression, we explain everything you need to know about antidepressant drugs, from SSRIs and SNRIs to their effectiveness, common side effects, and how to decide if they're the right choice. You'll learn what antidepressants really do to your brain, the science behind serotonin, dopamine, and mood, the truth about antidepressant side effects, why medication isn't a weakness but a treatment, when and why doctors prescribe antidepressants. Whether you're managing depression, supporting a loved one, or simply curious about mental health science, this podcast gives you clear, compassionate answers based on real evidence. Before we start, don't forget to subscribe, like, and share this episode. It helps us reach more people and continue spreading awareness about depression and mental health. Now let's explore what's really behind those tiny pills and how they're changing, and sometimes challenging, lives. Antidepressants are medications designed to treat symptoms of depression and sometimes anxiety disorders. They're not happy pills or a shortcut to avoid life's problems, as some misconceptions suggest. Instead, they work by adjusting the brain's chemistry, especially neurotransmitters like serotonin, norepinephrine, and dopamine. There are several classes of antidepressants. Selective serotonin reuptake inhibitors, SSRIs. These are the most commonly prescribed and include drugs like fluoxetine, Prozac, sertraline, Zoloft, and citalopram, Celexa. They increase the level of serotonin in the brain by blocking its reabsorption. Serotonin norepinephrine reuptake inhibitors, SNRIs. Examples include venlafaxine, Effexor, and duloxetine, Cymbalta. They act on both serotonin and norepinephrine. Tricyclic antidepressants, TCAs. An older class of drugs that are effective but often have more side effects. Monoamine oxidase inhibitors, MAOIs. One of the earliest types of antidepressants, rarely used today due to dietary restrictions and interactions. Atypical antidepressants. These include medications like bupropion, Wellbutrin, and mirtazapine, Remeron, which work differently than the classes above. To understand how antidepressants work, we need to briefly talk about brain chemistry. Our emotions, thoughts, and behaviors are influenced by neurotransmitters, chemicals that help transmit signals in the brain. In people with depression, there's often a dysregulation in these chemicals, especially serotonin, norepinephrine, and dopamine. Antidepressants aim to balance this system. SSRIs prevent the reuptake of serotonin in the brain, making more of it available. SNRIs do the same for both serotonin and norepinephrine. TCAs and MAOIs also affect neurotransmitters, but in broader ways, which can lead to more side effects. It's important to understand that these medications don't produce immediate results. It often takes 2 to 6 weeks before patients notice any improvement. That's because the brain needs time to adjust to the new chemical balance. And here's something crucial. Antidepressants don't cure depression. They manage symptoms, ideally giving people the mental space to engage in therapy and lifestyle changes. This is a question many people ask, and it's a fair one. According to numerous studies and reviews, antidepressants can be effective, especially for people with moderate to severe depression. The National Institute for Health and Care Excellence, NICE, and the American Psychiatric Association recommend them as part of a comprehensive treatment plan. Here are some facts. Antidepressants are more effective than placebo in many trials. For mild depression, medication might not show significant benefit over talk therapy or lifestyle changes. The effectiveness often improves when combined with psychotherapy, such as cognitive behavioral therapy, CBT. However, antidepressants don't work for everyone. Around 30 to 50% of people might not respond to the first medication they try. That's why doctors often adjust the dose, try another medication, or combine different treatments. Expectations also play a role. Some people expect instant happiness, and when that doesn't happen, they feel discouraged. But medication is often a foundation, not a full solution. All medications have side effects, and antidepressants are no exception. The key is understanding what to expect and how to manage them. Common side effects of SSRIs and SNRIs include nausea, headaches, insomnia or drowsiness, sexual dysfunction, weight gain or loss, dry mouth, dizziness. These symptoms often lessen after a few weeks, but for some people they can be persistent or bothersome. Communication with a healthcare provider is essential. Never stop medication suddenly. It can cause withdrawal symptoms or worsen depression. TCAs and MAOIs may cause more severe side effects like blurred vision, constipation, urinary retention, high blood pressure, especially with MAOIs if interacting with certain foods. In rare cases, antidepressants may increase suicidal thoughts, especially in young adults under 25. That's why close monitoring is necessary during the first few weeks of treatment. Despite medical evidence, antidepressants are often misunderstood. Some people think taking them means you're weak or not trying hard enough. This stigma can prevent people from seeking help. But here's the truth. Taking antidepressants is a medical decision, not a moral one. If you had diabetes, would you feel ashamed for taking insulin? Mental health deserves the same compassion and logic. Medication can be life-changing or even life-saving for many. And yet, it's not for everyone, and that's okay too. We need to normalize the idea that mental health treatment is personal. What works for one person may not work for another. And there's no shame in trying different paths. So, when should someone consider taking antidepressants? While the decision should always be made with a qualified professional, here are some signs. Your depression is moderate to severe. Therapy alone hasn't helped. Symptoms interfere significantly with daily life. There's a history of depression in the family. You're experiencing suicidal thoughts. Remember, medication is just one part of a broader treatment plan. Therapy, social support, lifestyle changes, mindfulness, and sometimes spirituality all have roles to play. If you're unsure about antidepressants, talk to your doctor. Ask questions. Express concerns. You deserve to be fully informed. Antidepressants are not magic pills, but for many, they are an important tool in the healing journey. They come with benefits and risks, just like any treatment. But most importantly, they represent hope that things can get better. Disclaimer. This video is for educational purposes only, and this video content is made only as a suggestion from someone who is not an expert. Sorry if there are any mistakes in the explanation and accuracy of the information. Please consult a licensed healthcare provider for personalized guidance. Because this channel only helps through information, it is recommended to visit an expert if you have a serious problem regarding this mental health. Thank you for being here today. We hope this episode helped clarify some of the confusion around antidepressant medications. If you found this helpful, please like, comment, share, and subscribe for more in-depth discussions on depression, mental health treatments, and emotional well-being. Let's keep the conversation going because mental health matters. Until next time, stay mindful and stay kind to yourself.